Y'all, it's Bear. It's Monday, April 25th, 2022. I have tried to shoot this video like half a dozen times. Something keeps happening. It's getting really old. So here's crossing our fingers to getting through this video. Today I want to talk about the subject of what to ask your surgeon when you go in for your top surgery consultation. Side note, people can be really crappy about asking questions on the internet, and stop it. uh, we have the internet as a great resource to reach out to people with common issues, common interests, and that we share a common thread with. Um, in the case of being trans, not everyone in your life is trans that you can just like reach out to. Your parents, your mentors, your peers, your coworkers, they tend to be straight cisgender people. And even if they are gay or trans or whatever, that still may not be applicable to you. You know, if I have a trans female friend, she's not going to know about top surgery. So let people go ahead and ask questions online and stop being a jerk. Anyway, so one thing that I really advocate for a lot, and I've talked about in previous videos, is grabbing a journal for your transition. This is for doctor's appointments, and it's for actually just journaling. you're gonna you're gonna have feelings as you're going through this. You're gonna have issues that come up with your family or your coworker, or stuff that just pops into your head. Maybe you're an artist. Maybe you want to jot down some notes or some thoughts or whatever. Journaling is a really good method for that, and you can grab a small journal and carry it around with you. This is mine. I bought this in 2014 at a regular bookstore. I actually went to their used section and grabbed like a blank journal for less than $5. The other reason I really push people to do this is so that they can take it with them to their doctor's appointments. And that applies to this video, so that's why I wanted to talk about it. If you are anything like me, you get excited and you forget stuff. So doctor's appointments are exciting in the case of going in for your top surgery consultation, or they're nerve wracking. Like in the case of going in for testosterone, you don't know if this person's gonna agree to prescribe you testosterone. You don't know what hoops you're gonna have to jump through. You don't know about levels and the math that goes into your prescription, because it's so many milligrams per milliliter, and then you go home and you have syringes and you're like, oh my God, which one's which? Well, if you took a journal with you, you can ask those questions. You can take down notes while your nurse is explaining this to you, and you can look that up a week later and remember, oh, this is how I draw up, this is how I do my shot, this is what I need to do. Cool. For your consultations, you're gonna be nervous and you're gonna be excited, and you may forget in the moment what questions you wanted to ask, or on the other side, you may forget what they told you. Right? You walk out of a doctor's appointment with a lot of information in your head. If you wrote it down, you've got it with you, and you're pretty much golden. So these are the notes that I took back in 2015 when I went in for my top surgery consultation. The highlighting I did to talk about during this video, but I write down their answers and then I repeat their answers back to them. That's my method for understanding. Like, okay, am I getting you right? Like, let me repeat it back to you. Check. Got it. Write it down. Move on to the next question. So, our topic for today: what questions to ask during your top surgery consultation. You want to ask, first and foremost, you want to ask them. They're gonna look at your chest, and I want you to be ready for that, because it's kind of just a dysphoric moment. This is a part of your body you don't really want on you anymore, and they're going to have to examine it. After that, have the discussion with them. What type of surgery do they recommend for you, and what does that entail? So, for instance, for me, I had a larger chest. I was going to end up with double incision. I went in expecting that. I did my research before the appointment, and I expected them to say double incision, and they did. And there wasn't any moment where it was like, well, maybe we could get away with one of the less invasive surgeries. No. And I liked that about my surgeon. He wasn't like, well, these are some options for you. He just went straight for, this is what I'm going to suggest, and this is why. Cool. Okay. Um, there are different types of top surgery, so they're going to vary, and the results and your aftercare and your recovery time are all going to vary, and I'm not going to get into all those details in this video. But that's right there. That's the first question you're going to want to ask. What type of surgery do you recommend? And then ask what they do as far as their incisions or their methods, right? So for me, again, double incision, I was like, okay, do your incisions join at the middle? Some people do the straight across kind of scar. Some people do kind of the straight lines. Mine are actually curved and they are under my pecs. And he told me that he wanted to do that. We're gonna wait. We're gonna wait while the garage door closes. I don't know how that sounds on the video, and I don't want to stop again. Anyway, um, he told me that he was going to put the incisions underneath and the positions that he likes to put the nipple grafts in. So that brings us to our next point: is nipples. Do you want them? Is your surgeon cool with not doing them? If you're in the case of double incision, they're going to remove part of the areola and they're going to replace it on your chest somewhere else, so that you have a male looking nipple. In the less invasive surgeries, they don't have to do that, so that's not really an issue. But if you don't like your areolas and you don't like your nipples, talk to your surgeon about that. Like if they're too large, if they're misshapen, whatever, they may be able to address that in the same surgery. So ask about your nipples, ask about your incisions. Recovery time. This again is going to differ depending on which kind of surgery you get. If you get keyhole surgery, or periareolar, your recovery time is going to be drastically shorter than if you get double incision. Um, Ask about that recovery time. Ask when you can go back to work, and ask when you can go back to your activities. Ask when you have to stop your activities before surgery. So I'm into martial arts. It's a contact sport. Um, my surgeon wanted me to stop any kind of contact, although I could go work out. He didn't want any contact for 2 weeks prior because of bruising and inflammation. And then obviously because of chances of infection, damaging your incisions, swelling, bleeding, and so forth, he didn't want me to go back to martial arts until the 6 week point, when he also said I'd probably be good to go back to work. Work was kind of a question at the time. I was doing a job that required lifting. So he was like, I've got an estimate of like 5 to 7 weeks. Tell your job 5 to 7 weeks, and we'll assess at the 5 week point. So that was something I needed to know so I could go back to work and fill out paperwork saying I want this time off for surgery. So ask about your recovery time, ask about your activities. Um, and then you want to ask about your touch up surgeries, which is also called a revision. This happens with a lot of plastic surgery. In the case of top surgery, you are taking flesh that is rounded and you're trying to make it flat. And there's a chance that you're going to have to deal with a little corner. That corner is called a dog ear, and it can happen at either end of your incisions. People get dog ears in the center and they get them under their armpit. I have one under my right armpit. It doesn't bother me. I probably could have gotten it addressed, and I didn't really care to. I was like, it's fine. I don't mind. Some people really don't like them. Some people really worry about how their chest looks. They really want to be able to pass at the beach with their shirt off and so forth. So depending on what you want, go ahead and address that with your surgeon. And then how are revisions covered? Are they covered under the same insurance bill? Are they in office? Are they under anesthesia again? That's going to differ per surgeon. And then you want to ask, how long have they been doing this, and why did they choose to start doing gender corrective surgeries? You want to know what their motivation is. Is this a money thing because right now it's a big market, or did they know a transgender person whose life was affected and changed by having their surgery? You want to ask kind of why they got into it and how long they've been doing it. That's, in my mind, that's the more important question. If your surgeon has only been doing top surgery for like a year and a half, you may want to go with somebody more experienced. Maybe you want to give them that experience. That's up to you, but you want to know what you're getting into. And then, last but certainly not least, is your before and after photos. Most plastic surgeons will keep a binder of photos. You are going to sign a waiver about that. Don't, if you're not cool with your pictures being shared with future clients, you can waive that. You can say no. You're gonna sign something. Ask about that too. Uh, but yeah, you want to see those before and after photos, and you want to see the pictures that are really applicable to you. So again, I'm a short, stocky guy. I'm 5'2", and I've always been right around 150. I'm just stockier this way. So my surgery is going to be different than somebody who's 5'9" and like 100 pounds wet, right? Like the beanpole body types. They're gonna have a drastically different before and after picture, and you want to see the ones that are really applicable to you, and you want to ask them about what methods they used on either or both. In my case, my top surgeon was known for not having like this great bedside manner because he's kind of quiet, but he answered my questions. He took the time to listen to me repeat those answers back. He answered me again, and he showed me those pictures, and he showed me pictures of the bottom surgery that I was kind of thinking I might go for, which I still haven't pursued. But he took those pictures out and he showed them to me, and he took the time to talk about a surgery that I wasn't even there to actually talk about. So that to me was a huge mark in his plus column, in his pros column, as opposed to the cons. So ask for those before and after photos, and then you can ask about the anesthesiologist and the medications that you're going to be prescribed. For me, pain pills make me really nauseous, and I didn't want to be on any of the really heavy stuff. And we addressed that right there during my consultation. We addressed it right before surgery when I got the actual prescription. So that's me. If you've got any other suggestions or questions about that, go ahead and shoot them in the comments. Thanks for listening, and I got through the take. Sorry about the garage. See you later.